Hello everyone, my name is Jaskiran Kaur. I am a student at Indiana State University in my nursing 444. This is my community health project regarding the hypertension. My objectives for this topic is what is hypertension, what are the causes of hypertension, identify the signs and symptoms of high blood pressures, describe how hypertension can be measured in the body, discuss various resources for lifestyle modifications, recommendations, and how to treat hypertension with medications. First of all, let's pause here and do the attached pretest that is under the description under this video. Who is most likely to develop high blood pressure or who population at risk? So my PAR is people with family members who have high blood pressures, smokers, African Americans, pregnant women, women who take birth control pills, those over the age of 35, folks who are overweight or obese, inactive people. What is hypertension? Hypertension, also known as a high or raised blood pressure, is a condition in which the blood vessels have persistently raised pressure. Blood is carried from the heart to all parts of the body in the vessels. In the picture below, it says on the left, no hypertension, on the right, it's hypertension. When the heart pumps blood through the arteries, the blood puts pressure on the artery walls. This is known as blood pressure. There are two kind of hypertensions. First is the primary or essential hypertension. Elevated BP with unknown cause. 90% to 95% of all cases have those primary hypertension. Secondary hypertension, elevated BP with specific cause. 5% to 10% in adults. Primary hypertension has the contributing factors for this hypertension is increase in sympathetic nervous system activity, diabetes mellitus, increase in sodium intake, excessive alcohol intake. And the secondary hypertension, its contributing factors are coarctation of aorta, renal disease, endocrine disorders, neurological disorders, and the treatment for this is treat underlying cause. Hypertension complications. Complications are primarily related to the development of atherosclerosis or the hardening of arteries or fatty deposits that harden with age. On the pictures below, you can see how that plaque it's collected there that cause hypertension. Risk factors. High blood pressure has many risk factors that include age, race, family history, being overweight or obese, not being physically active, using tobacco, too much salt slash sodium in your diet. Normal blood pressure readings. So on the picture below, it shows here it's 120 over 80. That's a normal blood pressure reading. And the blood pressure higher than 130 over 80 can cause serious health problems. Includes heart disease, stroke, kidney disease, dementia. So have your blood pressure checked at least once a year or more often if you know you are have a hypertension. Categories of blood pressure. Blood pressure has categories that includes normal blood pressure, elevated blood pressure, high blood pressure, that's our stage 1, high blood pressure or stage 2, and a hypertensive crisis. And then on the picture, it shows you how the readings reflect with each category. This picture shows how the in the vessel, the normal vessel, pre-hypertension, and then hypertension vessel. So it's just kind of closing when it's a hypertension there. There are many facts about the hypertension that includes having hypertension puts you at risk for heart disease and stroke, which are the leading causes of the death in the United States. In 2018, nearly half a million deaths in the United States included hypertension as a primary or contributing cause. Nearly half of adults in the United States have hypertension, defined as a systolic blood pressure that is greater than or equal to 130 millimeter of mercury or a diastolic blood pressure greater than equal 80 are taking medications for hypertension. Only about 1 in 4 adults with hypertension have their condition under control. About half of adults with uncontrolled hypertension have a blood pressure of 140 over 90 or higher. This includes 37 million US adults. About 30 million adults who are recommended to take medication may need it to be prescribed and to start taking it. Almost 2 out of 3 of this group have a blood pressure of 140 over 90 or higher. High blood pressure was a primary or contributing cause of death for more than 494,873 people in the United States in 2018. High blood pressure cost the United States about $131 billion each year, averaged over 12 years from 2003 to 2014. So, this is the website you can go to on the CDC website about these facts. Symptoms. It's a silent killer, usually no symptoms until it reaches an advanced state. When a severe stage is reached, strenuous exercise and other forms of stress may cause headache, visual disturbances, vomiting, convulsions. It may continue to be asymptomatic. Symptoms of severe high blood pressure include severe headaches, nosebleed, fatigue, confusion, vision problems, chest pain, difficulty breathing, irregular heartbeat, blood in the urine, pounding in the chest, neck, or ears. Laboratory diagnosis test. Most people are not aware they have hypertension until they have routine medical checkup with their physician because lack of symptoms. How do I know if I have high blood pressure? There's only one way to know if you have high blood pressure is have a doctor or other health professional measure it. Measuring your blood pressure is quick and painless. Talk with your healthcare team about regularly measuring your blood pressure at home, also called self-measured blood pressure monitoring. High blood pressure is called the silent killer because it usually has no warning signs or symptoms and many people do not know they have it. How is blood pressure measured? It is important to measure blood pressure more than once because it fluctuates over the course of the day. It can also change due to things like physical exertion, stress, pain, extreme heat, or cold. So there are two different blood pressure readings are made of two values: systolic blood pressure and diastolic blood pressure. Treatment goals. Goal is to reduce overall cardiovascular risk factors and control BP by the least intrusive means possible. So the goals are BP less than 140 over 90. In patient with diabetes or renal disease, goal is less than 130 over 80. Treatment with lifestyle modifications. Lose weight if overweight. Limit alcohol intake. Reduce sodium intake to less than 2.3 gram per day. Maintain adequate dietary potassium, calcium, and magnesium intake. Perform aerobic physical activity for 30 minutes per day. Eat diet rich in fruits, vegetables, low fat dairy products. Reduce saturated fat and cholesterol and stop smoking. Medication used to treat high blood pressure that includes diuretics, ACE inhibitors, angiotensin 2 receptor blockers, calcium channel blockers, and then other medication includes alpha blockers, alpha beta blockers, aldosterone antagonist, renin inhibitors, vasodilators, central aging acting agents. Benefits of lowering BP includes stroke incident reduction in 35 to 40%, myocardial infarction 20% to 25%, heart failure about up to 50%. These are the references. You can get more information about the hypertension. So in our community, it's very important to control the blood pressure, and we need to educate our community what can happen if they have a high blood pressure and what are the complications. So thank you so much for watching.